Hey everybody, it's Walking Man Walks back here again in beautiful Malaysia, Kuala Lumpur. I just wanted to put together a video today about the healthcare situation, the assassination of the healthcare CEO Brian Thompson in the US. I just wanted to weigh in my thoughts and opinions on that. So let's go. Okay, so as you all know, last week the healthcare CEO in the US was assassinated. They caught the guy, and it was what we all suspected was a guy that was wronged by the healthcare system somehow, particularly U.S. healthcare, I think. I guess he had a bad back injury, and they were denying him coverage. He had a bad surgery, and this wasn't a poor guy. His name was Luigi Mangione. He had tons of money, I guess his family did anyway, and they actually were in healthcare. I mean, they owned healthcare facilities for older people, like my mom was in before she died. But I haven't had too much experience with the healthcare system in the U.S. myself. Besides, like a couple of years ago, I had a what they call a PK over here. It's a something you get from being in the sun a lot, especially if you're from northern descent. They say people who are descended from Neanderthals, which it's a tangent, but I always thought I was because back when I was in school studying geology and paleontology, we studied Neanderthals, and they have an occipital lobe on the back of their head. That's one distinction for somebody who has DNA from a Neanderthal, and I've always had this prominent lump. It's where your spine meets your skull. It's called the occipital lobe. Anyway, that's neither here nor there. But I went for this skin thing. I have good health care coverage, or what I thought was good health care coverage from my government job. And I called them up first, and I asked them if I was covered, the dermatologist, and they said yes. I went there, they did some stuff to the PK, they put something on. They said it's not cancer or anything, it's not that big of a deal, but we're just going to treat it. And so anyway, it was fine. It wasn't a big deal. It's not a painful thing. It was just like a mark on my forehead, basically. And when I went to check out of the dermatologist, they were like, okay, that'll be $350 or something like that, I think it was. And I was like, whoa, I thought I was covered. And like, they started giving me the usual healthcare runaround. They said, well, you're out of network, you need to pay it and then deal with your healthcare company. I ended up just paying it and not even going through the myriad of paperwork and nonsense I had to do to get the healthcare. And that's one of the problems with the healthcare in the US. It's like, that was just a mark on my head. But if I had cancer and was dying, if you don't have anybody to deal with that in your life, what are you going to do? You have to either pay what they want, go into debt, go into medical bankruptcy, which 500,000 people, I think last year, went into medical bankruptcy in the US. So the US healthcare system is completely broken, and a lot of people are looking at Luigi Mangione like he's a hero for assassinating this healthcare CEO. And, that's common people. If you look on the internet, the masses are saying, oh, this was a great thing. We don't feel sorry for the guy. And maybe you could feel sorry for the healthcare CEO as a person, but, his job was to make sure people's healthcare was denied so they made more profit. That's why for-profit healthcare is a bad system, because they have to make a profit. A corporation, their first fealty is to their shareholders, making money for their shareholders, where if we had a single payer system completely run by the government, like Medicare for all, then it would be run for the sick people, not for the shareholders to make a profit. I've been on this side, on the left side, especially with healthcare for years. And years ago, there was a lot more people in the US who were like, oh, I like my private healthcare. But now it's starting to turn around. The private healthcare industry has gotten so bad. It doesn't matter who you are, unless you're in the 1%, you can't get the health care you need, or you're denied coverage, or they'll deny, even though they should be giving you the treatment you need. They'll deny them just because they know that you don't have the money or the willpower or the whereabouts, or you're well enough to sue them or to go through the long, arduous paperwork and phone calls for hours to actually fight them on the treatment. So the media's reaction, the corporate media, MSNBC, I saw Chris Cuomo, the ex CNN anchor who lied basically on CNN for his brother, the governor of New York, and then he lost his job, but he sued him, so he's still getting paid. He was making $6 million a year at that job. He's worth $12 million. And he's out there shilling for the corporate CEOs, like, oh, this can't happen. You can't kill corporate CEOs. And I agree that going around and killing them is not the way to solve this. However, killing this CEO has sparked something in the US people, in the people of the United States, and both the left and the right are united in wanting to take down the big private healthcare companies. And if Congress doesn't react and respond, something is going to happen. There will be a revolt or something. All that being said, as you guys who follow my channel know, that my girlfriend was in the hospital 2 weeks ago now for a week, and the health insurance here or in the Philippines is not good either. So I had to pay out of pocket for her hospital stay. All told, it came out to almost $2,000 by the time I got all the medicine and everything. And yeah, I did go to a private hospital, the best hospital in the city we live in, because I heard nightmares about the public hospitals. Like, if you go there, you go on a waiting list. She was in an emergency situation. She needed to go right then. I had to make the choice whether it cost me, I didn't know how much it was going to cost me, but I knew it would cost me a bit. However, that same thing in the US would have, probably bankrupted me, or, at least taken $10,000, not $2,000, or maybe $20,000. I mean, she was in the hospital for 4 nights, on an IV the whole time. So I don't know what would have happened in the US, but I do have health insurance, so we probably would have been covered there. I'm not even sure. So the Philippines, in a lot of ways, they model the US, and in their health insurance, unfortunately, there's not even insurance available for an expat like me, I don't think. And then the insurance, PH Health, I think the initial bill was 80,000 pesos. They paid 7,000 pesos or 10,000 pesos, a very small amount. So, I mean, it's not expensive, PhilHealth, but I don't think there's an upgrade, a public upgrade that I could get for her, or I would. But I've heard PhilHealth covers, different stuff. They'll cover like all of a pregnancy, maybe, I'm not sure. I'm going to have to look into it further in the future. But their public healthcare system's not great either. Now you look at the European model and the Canadian model. Yes, you could get private healthcare if you're wealthy and you want extra healthcare for, elective surgeries, plastic surgery, stuff like that. But for your basic health needs, if you crack your head open in a car accident, or you crack your head open playing basketball, you go to the hospital in those countries, and with the single payer system, you're covered. It's come out of your taxes, and taking it out of your taxes is a lot less expensive to each person than how we do it here. Each person, some people who don't have a government plan like me pay $1,000 a month for their family to have health care, and then they're denied coverage when they go to the hospital. It's a completely insane system, and it needs to change. So I want to hear your comments, your healthcare nightmares, what you have to say about the assassination of the healthcare CEO, if you're all for it or you're against it. I'm not condoning assassinating anybody, but this particular assassination, and I feel bad for the individual guy and his family, although I'm sure his family is going to be fine. He was making $10 million a year to deny health care to people. So I'm sure his family is going to be fine. I'm sure they had a lot of money and all that. But, I still feel bad. He was younger than me, shot down in the streets. That's not great, but he was killing people. It's socialized killing people when you're doing it legally like he was, but he was still responsible for the deaths of many people. Okay guys, as you know, I do get political on my channel. I'm not like most expat Philippine vloggers. I do like to talk about politics sometimes. I know it pisses a lot of you off, but my next video will be about Malaysia and traveling here and sites and stuff like that. But go ahead and comment below. You know, if you don't like what I have to say, let me know. But I think right and left, we're all in agreement that the healthcare system in the US needs to be fixed. So go ahead and let me know how you feel about that. Comment below, subscribe, share, like, hit the bell so you know when my next video is dropped, and I'll see you guys next time. Have a good day.